afternoon, and thank you for joining us for today's media briefing about COVID-19 in London and Middlesex County. We're joined today by London Mayor Ed Holder, the Acting Medical Officer of Health for the Middlesex-London Health Unit, Dr. Alex Summers, and Carol Young-Ritchie, Executive Vice President and Chief Nursing Executive with London Health Sciences Centre. We'd like to welcome the media who are in attendance this afternoon and invite them to submit their questions using the question forum here on Microsoft Teams. We'd also like to welcome those tuning in this afternoon on Rogers Television, Rogers Facebook page and YouTube channel, and those watching on the CTV London website. We'll get to the opening statements right away, and we'll start with London Mayor Ed Holder. Mayor Holder.
Well, thank you, Beth, and good afternoon, everyone. So we heard some exciting news from the Premier earlier today regarding further loosening of public health restrictions on a slightly accelerated timeline. So come this Thursday, capacity limits will be lifted at most indoor public settings where proof of vaccination is required. And as of March 1st, capacity limits will be lifted entirely at all venues, including sports and concert venues. As of that date as well, proof of vaccination will also cease. Now, these are decisions which are supported by a number of steadily improving metrics, none of which have suffered or stalled even as other restrictions have been eased and lifted. As the Premier stated clearly, this has nothing to do with the ongoing convoy occupation in Ottawa, nor recent activities in Windsor or Sarnia. I concur. For starters, and throughout the pandemic, we've seen timelines shift repeatedly, whether it's keeping restrictions in place for longer than expected or, in some cases, shorter periods of time. This has everything to do with science and data, nothing to do with illegal occupations. If you want to credit convoys for improving circumstances, credit the steady convoy of Londoners and others across Ontario who rolled up their sleeves to ensure we're among the most vaccinated jurisdictions in the world. Credit the convoy of healthcare staff and volunteers who ensure those vaccination clinics have run as smoothly and efficiently as they have throughout the pandemic. Give credit to the convoy of nurses, doctors, PSWs who put in extremely long hours day after day, missing family and working under exceptionally difficult circumstances. And finally, credit the convoy of essential service workers who, when most other services were closed, continued showing up for work, ensuring our society continued to function. Those are the convoys deserving of credit and most deserving of our thanks. Speaking of which, I'd also like to offer my deepest gratitude and appreciation to members of the London Police Service who did absolutely incredible work over the weekend. We've had officers assisting with the sad situation in Ottawa. We also had officers dispatched to Windsor to assist with the peaceful and professional clearing of the Ambassador Bridge. Further to that, our London Police Service and other city staff also ensured a convoy protest in London, our second in as many weekends, proceeded quickly and with minimal disruption. Clearly, they have far too much time on their hands. Yours is not easy by any stretch, even if you make it appear otherwise. Thank you for answering the call once again. And to all of the people who I've cited so positively and thoughtfully, thank you for doing this with such dignity and professionalism. Well, that's it for me. So over to you, Dr. Summers, please.
Thank you, Mayor Holder, and good afternoon, everyone. Happy Valentine's Day to all. The Middlesex-London Health Unit is reporting 64 new cases of COVID-19 today. This brings our total number of COVID cases since the beginning of the pandemic to nearly 31,000. Over the weekend, we had 113 new cases reported on Saturday and 80 new cases reported on Sunday. We also tragically reported additional deaths over the weekend, with 3 new deaths reported on Saturday and a death reported on Sunday. Of those deaths, 3 were individuals in their 80s and 90s who had been vaccinated, and 1 was an individual in their 50s who had not been vaccinated. The case counts continue to plateau and decline. This is favorable, certainly, and it has resulted in an accelerated timeline at the provincial level to expand capacity in public settings starting the end of this week. We are also seeing encouraging metrics in the ongoing decline in the number of outbreaks in long-term care homes as well as other congregate settings. Things are looking better. However, I would highlight again, as I have in previous weeks, that the volume of COVID-19 transmission in our community remains higher than at any other point preceding this Omicron wave. And so it still is essential that we all take appropriate precautions to protect ourselves, including masking when you are in any public indoor setting, and of course, getting boosted or getting vaccinated as soon as possible. The Middlesex-London Health Unit's mobile COVID-19 vaccination efforts continue. Last week, we had our 3 community hub COVID-19 vaccination in clinics, or in schools, and we saw the administration of 157 doses, including 54 first doses and 82 doses administered to children 5 to 11. This past Saturday, there was a mobile clinic hosted at the Kipps Lane Neighborhood Center Clinic, supported by the Middlesex-London Paramedic Service, where we also saw a tremendous turnout with support from the London Cross-Cultural Learners Center and volunteers from Helping Hands Without Borders Canada. We saw over 180 doses administered, including 47 first doses. There is clearly still an appetite for vaccination in our community, and our efforts to ensure that those vaccines are readily available continue. This coming week, we will have 10 community hub COVID-19 vaccination clinics in schools, 2 running each day. We will also have the Middlesex-London Paramedic Service servicing both the city and the county, including a drive-through clinic in Kerwood tomorrow, February 15th. Through all of this, our mass vaccination clinics continue to be available for walk-in appointments as well as scheduled appointments. It is so essential that we get our booster doses and that we get vaccinated. The province announced today that starting this Friday at 8 a.m., 12 to 17-year-olds will be eligible to receive and book a booster dose in order to get that extra protection against COVID-19. The Middlesex-London Health Unit will be certainly following suit. We strongly encourage, starting Friday, for 12 to 17-year-olds who have received 2 doses of vaccine to book a booster dose so that they can gain that additional protection. As we see things reopen, I want to again highlight the critical steps that we can all take through this winter season to continue to protect ourselves and those around us. The COVID-19 pandemic will indeed someday come to a close. However, COVID-19 and the SARS-CoV-2 virus will be with us forever. It will come and it will go, similar to how I think we experienced the influenza season. However, what we have experienced continues to suggest that SARS-CoV-2 and the COVID-19 illness is significantly more severe with regards to the number of people it can put in hospital, even compared to influenza. So even as we hope for days in which we are able to return to our activities, like going to concerts, like going to movies, like attending sporting events, may we remember that we must continue to do things a bit differently. Wear your mask, get vaccinated, and of course, if you're sick, stay home. I'm going to pass things over to Carol Young-Ritchie from the London Health Sciences Centre. Thanks, Carol.
Thank you, Dr. Summers, and good afternoon, everyone, and thank you for having me here to share an update on the COVID-19 situation at London Health Sciences. As of this morning, we are caring for 89 COVID-19 positive inpatients, and we have 17 patients in our critical care units. In our children's hospital, there are 10 inpatients with COVID-19 and fewer than 5 of those being in pediatric critical care. I'd like to note, while this number is slightly higher than normal for our children's hospital, the majority of cases are those admitted with COVID and not for COVID. Overall, we're happy to report that we're beginning to see more of a downtrend in our inpatient numbers, which allows us an opportunity to redeploy resources to other areas. We continue to ramp up services in accordance with direction from the province, which directs how limited services in specific areas may be gradually resumed. We are doing so while being very conscious of trying to balance the increased need for surgical care with our health human resources and need to be conscientious of what we're seeing in the emergency rooms. Another piece of positive news is that we're happy to share is around our visitor policy. As of Wednesday, February 16th, we'll be allowing both essential and non-essential care partners into the hospital. I'd like to encourage those who this impacts to visit our hospital website for more specific information. Finally, given that the theme of the day is showing admiration, I'd like to take a moment to share some appreciation and admiration of a few groups. First off, our staff. This extends to all LHSC staff for their continued focus on compassionate patient care as we continue to battle COVID-19. And I'd also like to give special mentions to the staff who've been working on the units experiencing outbreaks, as we recognize the toll it takes. I'm proud to report that as of the original cluster of 12 outbreaks, we are now down to 3, with the expectation that most will be called off in the coming days ahead. Our staff have worked tirelessly to make this happen, and I want to express our sincere thanks. I'd also like to extend a thank you to our police and our city partners for their continued support over the past weeks, ensuring protests do not impact accessibility to our sites and for those who require or to provide care. Our staff and patients appreciate your diligent efforts in keeping our hospital a safe place. Thank you. Back to you, Beth.
Beth, I'm going to suggest.
All of that was on mute. So thank you, Carol and Mayor Holder and Dr. Summers. I'll repeat myself again. We've got a number of questions in queue here, so I will get to them. And I'm just going to state off the top, a number of our questions here are very similar today. So I'm going to do my best to combine a few of them since we have so many questions in the queue today already. So the first is for both Dr. Summers and Mayor Holder. And this is from Dan Brown at the London Free Press. Dr. Summers and Mayor Holder, what is your reaction to the province announcing this morning that it is going to lift the vaccine passport requirement on March 1st, as well as capacity limits at places like bars, restaurants, and gyms this Thursday? Are these the right moves and the right timing? And combined with a question from Angela McInnes with CBC London, do you support the removal of vaccine passports, and would you encourage restaurants, bars, gyms, and other businesses to continue requesting them? So Dr. Summers, why don't we start with you and then we'll pass over to Mayor Holder?
Sure. Thank you for that question, Dan and Angela. Certainly, it is very encouraging to continue to see the ongoing decline in cases, the ongoing decline in outbreaks, the ongoing decline in the percent positivity of the tests that we are doing, as well as the gradual increase in vaccination coverage. We are here because of those that have stepped up and gotten vaccinated, and we are here because of those that have stepped up and continued to wear masks in public settings and to maintain social distance and keep their social circles small. This is not a coincidence that we are here. This is the fruits of our collective labors. As the reopening unfolds, we will have to watch those metrics closely to see and monitor closely whether or not case counts would rise again. As case counts rise, the risk of stress on hospitalizations in the healthcare system again rears its head, and that is what we are trying to avoid. So we'll continue to watch. What we do know is that the more people that are vaccinated and the more that we can ensure that those in public settings are vaccinated and masks, the lower the risk of COVID-19 transmission, and that is a good thing. And so even as these capacity limits increase and as restrictions decline, I would strongly encourage people to continue to seek opportunities to be with vaccinated individuals when you're in a close indoor setting, and of course, to continue to wear your mask. But we'll follow those metrics closely, and I'm strongly encouraged by what we've seen to date.
Thank you, Dr. Summers. And Mayor Holder?
Thanks, Beth. But thanks, Dan and Angela, for the questions. Look, I think it's an extremely positive announcement the Premier made today regarding the loosening of public health restrictions and by accelerating the timeline somewhat. I think what's important is that we follow the science, and numbers don't lie here. In this case, we have seen a very significant settling down of the numbers of individuals, both who get COVID, those who are hospitalized, those who are in the ICU. And as long as that continues, then I think the province is on exactly the right path. Because, you know, you try to balance physical care and care of each other with the types of regulations, commitments that we ask of Londoners. And how you find that balance isn't easy. And I think that's what you've seen here is you've seen the Premier try to find that right balance. But as he would be the first to say, it's due to the Ontario Medical Officer of Health that gives him the guidance and the direction, much as we look to our own Acting Medical Officer of Health for his wisdom and insight in terms of supporting and assisting the decisions that we make here in London. Could this go the other way, potentially, if the numbers go the wrong way? But right now, let's, I think, be optimistic by virtue of this loosening of the restrictions. Let me also add that in no way does this decrease the need for individuals to get their shots. Absolutely critical this be done. And if you're considering maybe you don't need your booster because of this, you get your booster. Because what you want to do is you want to avoid the dramatic impacts of getting sick as a result of COVID, because it is that you might not catch COVID with your shots, but what's really clear is that the impacts in terms of potential of hospitalization and worse, that's greatly diminished as a result of taking your shots. So to that 92% of Londoners, that's why that convoy of Londoners who have consistently rolled up their sleeves and said, yes, I honor them. And those who would rather protest in a negative way, I'm still going to encourage them, please, get your shots for your family's sake, if not just your own, because we want to keep you alive for a long time, maybe so you can protest again. Don't know.
Thank you very much, Mayor Holder and Dr. Summers, for that response. Our next question comes to us from Jane Sims with the London Free Press. It is for Carol Young-Ritchie and Dr. Summers. There was a jump in the number of children admitted to the hospital in today's hospital report, as you had mentioned, Carol, in your opening statements. Are you anticipating this trend to continue? So we'll start with Carol, and we'll see if Dr. Summers has anything to add at the end there.
Sure. Thank you for that, Jane. Yes, we did see an increase. And there's two things to remember with that we have lots of patients coming to hospital who need admission. And we continue to test for COVID on admission. Anybody comes to hospital for any reason. The 10 cases that we're seeing in the Children's Hospital, the majority of them are coming in who happen to have COVID on top of another reason why they're coming to hospital. So they're not being treated for COVID, but happen to have COVID. And again, as we want to make sure who's in the hospital and keeping things very safe and not spreading infection, we will continue to swab. And in the case with the 10 today, it's children who are coming in who happen to come in with COVID. As far as trending, I'll perhaps hand that over to Dr. Summers.
Thank you.
Thanks for that question, Jane, and thanks for the context, Carol. No, I don't see this as a significant trend at this point. I think when we're dealing with numbers that are this small, they may fluctuate a little bit around the lower end, but I don't think we have a trend on our hand at this point. A single day does not make a trend, and I don't think we can take any conclusions from those numbers today.
Great. Thank you, Dr. Summers and Carol, for that response. Another question here for us from Jane Sims with the London Free Press. It is for you, Dr. Summers. The provincial government is ending the use of vaccination passports on March 1st. Are you concerned that vaccine uptake will end at the same time?
Thanks for that question, Jane. Requiring vaccination in order to participate in certain events or certain activities has been demonstrated to increase vaccine uptake across the world. It is essentially a fact at this point, and we've certainly seen it here in Ontario. The removal of that impetus, therefore, does not provide further incentive for people to get vaccinated from that end. So certainly if the vaccine passport had been expanded to include 3 doses, we likely would have seen an increase in booster dose coverage. In the absence of that, I don't know if we will necessarily see a further decline of vaccine uptake, but I will come back to the mayor's comments. Whether or not there's requirements for your activities or not, that booster dose and a primary series of COVID vaccine remains the absolute essential ingredients for us to avoid any further public health restrictions. In addition, to avoid individuals ending up in hospital and to avoid people off sick. The impact of that booster dose is substantial on the protection it has from symptomatic illness and hospitalization and severe outcomes. particularly for older individuals. But for those that are in the younger age cohort, I think sometimes there's a sense that, why should I bother to get my booster when if I got COVID, because I have 2 doses anyway, I'll just have a mild illness and I can get over it. Well, the illness you'll have with COVID-19 may be mild, might not be. And we've had many instances of illness that may not put you in hospital, but it'll certainly put you on your back and will certainly keep you at home. And avoiding that is not, in my view, a little thing. Similarly, some of the longer term impacts of having COVID-19 we're still unpacking, and having that additional immune boost from a booster dose is not nothing whatsoever. So I hope, regardless of the requirements to have vaccination to participate in these activities, that people still take every opportunity to get boosted.
Thank you, Dr. Summers, for that response. Our next question comes to us from Angela McInnes with the CBC London. This question is for you, Dr. Summers. Booster doses for children 12 and up will be available starting Friday. What is the rollout plan for MLHU?
Thanks for that question, Angela. Yes, coming this Friday, booster doses will be available for 12 to 17-year-olds. Those appointments can be booked online. We strongly encourage booking appointments just so that we don't overwhelm our clinics all at once. The rollout plan will be similar to how we've rolled out vaccine before. Starting Friday morning, those appointments will be available to book online, and there'll be the opportunity through the gates at covidvaccinelm.ca to book appointments. All of our mobile clinics as well will offer vaccination as the form of a booster for that age population starting this Friday morning.
Great, thanks very much, Dr. Summers. Another question here from Angela McInnes with CBC London, and it is for you. Once restrictions are lifted on Thursday, how will the health unit track ongoing cases, spread, or outbreaks going further?
Thanks, Angela. We will continue to receive laboratory results and reports for COVID-19 positive lab tests. And we follow up with those cases in a risk stratified way, which means we focus our intensive investigations on cases associated with higher risk settings like long-term care homes, hospitals, retirement homes, etc. We will continue to do that. The restrictions this Friday don't change a thing. As the number of cases have gone up, we have truly focused on those higher risk settings. If we backtrack 6 months when case counts were low broadly, we were doing case and contact management on every single case. And I think in a perfect world, we would continue to be able to do that. However, as case counts get high and as COVID transmission becomes widespread, that's no longer possible, nor no longer an effective way to control COVID transmission in the community. We will continue to adjust our case and outbreak management approaches to align with the provincial requirements, as well as the epidemiology that's before us. For the time being, we will continue to focus case and contact management on highest risk settings in order to minimize morbidity and mortality amongst people who live, work, or act in those settings.
Thank you, Dr. Summers, for that response. Our next question comes to us from Jacqueline Lamel with 980 CFPL, and it is for you. Dr. Summers, the province has said a timeline for lifting masking requirements will come later. Under what circumstances do you believe it would be time to do so?
Thanks for that question, Angela. Oh, that's from Jacqueline. Apologies. Thank you, Jacqueline. Masks have proven to be an exceptionally beneficial way to limit COVID-19 transmission. Recent evidence reviews from Public Health Ontario have demonstrated specifically the impact of masking on disrupting transmission in schools. Wherever we have applied the use of masks to both protect the wearer from COVID-19, but also to protect those around you from the person wearing the mask, we have seen a reduction in transmission as a result of masking. And masking is a fairly easy thing to do. It has become familiar to us. And so I hope that certainly as we see still pronounceably high case counts in our community, that we continue to have masks as our default go-to moving into the spring. I think in order for us to see masking no longer of great impact in our community, we'll have to see substantial reductions in transmission, which will likely only happen as the weather gets warmer. I mentioned earlier how life will never quite go back to what it was before the pandemic because of the arrival of this new virus, this new very infectious, very severe virus in our community. And I think one of the things that I hope will continue for us is the use of masks, particularly during the winter seasons, where we see an increased transmission of respiratory illness, not just COVID-19, but also influenza. We may see masks not required in most settings come this summer, and maybe next fall and winter, we may, and I would strongly think that we will be putting masking back in place, certainly in our highest risk settings. It's a very useful tool. It's a simple tool. It's a tool that I think we can all get used to, particularly if it saves some lives and avoids us having additional public health restrictions.
Great. Thanks very much, Dr. Summers, for that response. So I'm going to look around the table. We've got 3 questions left and about a minute left in the media briefing, so we're good to proceed with answering the rest of those questions. And our next question is for everyone in attendance here. So it is from Jacqueline LaBelle at 980 CFPL, and it is for Mayor Holder, Dr. Summers, and as Carol Young-Ritchie. So I'll read it for everyone. The province is ending its COVID-19 vaccine passport system starting on March 1st. Do you believe the city, health unit, and hospital system is ready for this change? So we'll start with our city representative, Mayor Holder. Thank you.
Well, probably good to start because as the only non-medical person on this call that can respond to it, I'll try it from the standpoint. So the question about the is the city, is the health unit, is our hospital system ready for this change? Certainly from a municipal standpoint, we'll be ready. I can't speak to the others, and I'll allow them to do what they do. But what's really quite clear to me is that the ending of the COVID-19 vaccine passport system does not mean people should not get their shots, including their booster. Does not mean they shouldn't be very mindful of in the types of crowds where if you remember how we started with all this, we started a couple of years ago and there was this whole big issue of masks. Isn't it ironic that it ends? We hope it does with masks, that all the other things in between are dealt with. So people still will be prudent and will be more mindful probably than they've ever been about the risk of bad hygiene. Remember what we used to say? Wear your mask, wash your hands, and keep your distance. Well, you know what? Everything old is new again, and that's what I sense will be the case here.
Thank you. And Dr. Summers?
And thanks for the mayor's comments, and thanks, Jacqueline, for that question. I think as a system, we are ready, but it all depends, of course, on how the numbers trend. And certainly there is, and this is the challenge with the COVID-19 pandemic, there is uncertainty with regards to exactly how the reopening measures may impact transmission. It certainly, all of these measures, the implementation of these measures reduce the risk of transmission, therefore the lifting of them increases the risk of transmission. But what impact that has on the healthcare system, we will have to see. And so I think we will really have to continue to follow the numbers and the metrics at a provincial level in particular to understand exactly what the impact will be.
Thank you, Dr. Summers, and over to you, Carol Young-Ritchie.
Yes. One thing we've gotten good out of the last 2 years is change, because we've had a lot of it. So we are making plans. We're developing those plans. And again, what's really important here is that we keep our hospitals safe, and that's safe for people coming in and safe for our staff. So we are in process of looking at the planning and working with our infection disease and prevention professionals to make sure that we're keeping our organization safe. So putting a lot of plans in place, and again, that'll be our goal, to keep our organization safe and watch how the numbers go.
Great. Thanks very much, everyone, for that response. Our next question comes to us from Craig Needles with Blackburn Media, and it is for you, Dr. Summers. Dr. Summers, once vaccination requirements are lifted on March 1st, should Londoners feel confident that dining out is a safe activity? Are you worried that the change in rules will lead to a higher rate of COVID spread at restaurants?
Thanks for that question, Craig. When it comes to COVID-19, there's no such thing as safe and unsafe. Safe is not a dichotomous experience for us. What we can talk about is the spectrum of risk. As we participate in activities that bring us in closer contact with more people, with more people who may or may not be up to date on their vaccine status, the potential risk of transmission increases. So as vaccination requirements are lifted in settings where that's no longer the case, people are in close proximity, masks are removed, the risk will go up. That's the reality. How much will the risk go up? That depends on the prevalence of COVID-19 in the community, as well as how many people take it into their own hands to get boosted, such that those places are full of boosted people as opposed to folks that remain vulnerable to COVID-19. At the end of the day, the decision now around what is too risky versus not too risky lies in the hands of individuals to make those decisions about which activities matter to them. And so all I can speak to is